Hello everyone, I'm Avni Kaul. I'm a qualified nutritionist and a certified diabetes educator. Today we're going to be talking about the myths related to diabetes. So let's begin with the myth bust. Myth number 1. You show no symptoms of diabetes and hence you're completely fine. The fact is that there are a lot of people who are suffering from diabetes and are not even aware about it. The damage is happening inside. Diabetes mellitus is a chronic condition and can have serious complications. Every 10 seconds, a person dies of a diabetes-related cause. Myth number 2. Once you've been diagnosed with diabetes, you have to cut all kinds of carbohydrates. The fact is, you should have carbohydrates. They help in the body function and the metabolism. So next time, do not cut all the carbohydrates. Myth number 3. You're so slim, the chances of you developing diabetes are very less. The fact is that even slim people have a high abdominal fat. They may have a high fat mass, which predisposes them to diabetes. Myth number 4. Sugar is your only enemy. The fact is that diabetes has many more causes other than excessive intake of sugar. The causes could be a body mass index of more than 23, habitual physical inactivity, gestational diabetes, that is diabetes during pregnancy, a person above the age of 30 years, impaired glucose tolerance, if somebody in the family, parent or sibling has diabetes, a person from Indian or South Asian region are more predisposed to diabetes. Myth number 5. You have to completely avoid everything sweet. The fact is that as a diabetic, you can eat your sweets but only in moderation. Myth number 6. Diabetes is a lifestyle disease. The fact is that there are 3 types of diabetes: type 1, type 2 and gestational diabetes. Type 1 diabetes develops when the body is not able to produce any amount of insulin in the body. This kind of diabetes is usually diagnosed before the age of 30 and the person has to be on insulin treatment from the very beginning. Type 2 diabetes develops when the body is able to produce some amount of insulin. This kind of diabetes is usually linked to a person being overweight. Gestational diabetes develops among 5% of all the pregnancies and usually disappears when the pregnancy gets over. Women who have had gestational diabetes during pregnancy are at a higher chance of developing type 2 diabetes in future. Myth number 7. Diabetes is an individual condition and does not lead to anything else. The fact is that the diabetes can affect the heart, eyes, kidneys and the nerves. Coronary heart disease can result in a stroke. Diabetic retinopathy is a disease of the eye which can result in blindness. Diabetic nephropathy is a disease of the kidney and can result in kidney failure. Diabetic neuropathy is a disease of the nerves which can result in infection in the foot and ultimately amputation. Myth number 8. Humans are the only creatures who can develop diabetes. The fact is, keep an eye on your pets. Animals too develop diabetes. Myth number 9. Eating healthy foods will not raise my blood sugar levels. The fact is, eating too much of your healthy foods can also raise your blood sugar levels. So even if I have fruits or whole grains in excess, my blood sugar levels can shoot up. Myth number 10. If you are a diabetic, you need to consume special diabetic foods. The fact is, as a diabetic, you don't require these special diabetic foods like cookies, pastries or biscuits because they may not have any nutritional benefit and may even have a high fat content. You can use your popular foods by making certain modifications with the help of a nutritionist or certified diabetes educator. In the end, I would just like to conclude by saying that keep a check on your blood sugar levels, get your HbA1c tested regularly, and also remember that diabetes is a cardiovascular disease. So a person suffering from diabetes is twice as likely to suffer from a heart attack or a stroke as compared to a person who does not have diabetes. Stay safe, stay happy. Bye-bye. Subscribe for more videos on this particular channel.